Hello, I'm out here at the beautiful Asbury Park Beach, and I'm going to talk to you today about foods and nutrients that help prevent prostate cancer. I hope you can hear me well. This beach is so exciting. The people are so happy. It's crowded. So anyway, an estimated 268,000 American men will be diagnosed with prostate cancer during 2022. Most men with cancer cells on their prostate gland are unaware of it. Ingesting foods with anti-cancer activities while avoiding foods that promote cancer propagation may lower risk of developing prostate cancer, reduce need for aggressive therapies in those with low-grade disease, and improve clinical outcomes in those treated for prostate cancer. A 2022 meta-analysis found that meat, especially processed meat, may be associated with increased prostate cancer risk. Another recent study found that a high consumption of vegetables, fruits, and whole grains is strongly linked to protective effects against prostate cancer. Previous research has shown that specific foods can reduce prostate cancer risk and improve outcomes in those following an active surveillance, watchful waiting program or undergoing curative treatment. Diet, nutrients, and prostate cancer. About 1 in 8 men will be diagnosed with prostate cancer during his lifetime. However, regular consumption of certain foods is associated with lower rates of prostate cancer. By boosting intake of the following foods, men may significantly lower their risk. Walnuts. Feeding walnuts to mice inhibits the development of tumors and decreases tumor growth and size. It also lowers levels of IGF-1, insulin-like growth factor 1, a protein associated with prostate cancer. Other animal and cell culture research shows that walnuts inhibit the growth of prostate cancer cells, lower PSA, prostate-specific antigen levels, which may indicate prostate cancer when elevated, and reduce the size of prostate tumors. In older men, walnut intake improved biomarkers related to prostate and vascular health. Cruciferous vegetables. An observational study found that men with a high consumption of broccoli and other cruciferous vegetables like cabbage, spinach, cauliflower, and kale have a 40% lower risk of an invasive prostate cancer. A meta-analysis concluded that cruciferous vegetable intake is associated with an overall reduced risk of prostate cancer. These effects may be a result of cruciferous vegetables' abundance of beneficial compounds, including glucosinolates, indole-3 carbinol, 3,3-dindolylmethane, and phenethyl isothiocyanate. In other words, I3C, DIM, and PEITC. Flax seeds. In human studies, flaxseed intake has been shown to decrease proliferation of prostate cancer cells and reduce proliferation of tumors in as few as 30 days. Flaxseed contains lignans, which are converted in the body into compounds called enterolactones. Men with higher levels of enterolactones have been shown to be less likely to have prostate cancer than men with low levels. A meta-analysis found that consuming 4 or more cups of coffee daily was linked to a reduced risk of fatal and high-grade prostate cancer, as well as a lower risk of overall prostate cancer. Additionally, A large epidemiological study found that compared to drinking no coffee, drinking 6 cups of coffee, including decaffeinated, daily reduced the risk of prostate cancer by 18% and lowered the risk of lethal prostate cancer by 60%. Tomatoes. Lycopene is the carotenoid pigment that gives tomatoes their red color. A systematic review of cell and animal studies found that lycopene decreases androgen metabolism and signaling, an important factor in prostate cancer growth and progression. Additional anti-cancer mechanisms of lycopene are believed to include inhibiting inflammation and reducing oxidative stress within prostate tissue. Lycopene is known to inhibit the growth of prostate cancer cells in vitro, and higher circulating levels have been associated with reduced prostate cancer risk. Above average consumption of lycopene has been tied to a 59% reduction in the risk of death from aggressive prostate cancers. A meta-analysis found a significant association between a lower risk of prostate cancer and consumption of tomatoes, cooked tomatoes, and tomato sauce. The greater the tomato consumption, the greater the risk reduction. To enhance the absorption of lycopene from tomatoes, eat them in processed forms such as tomato sauce, or process them yourself by cooking and eating them with healthy fat such as extra virgin olive oil. Prostate protecting foods. 1 in 8 American men will be diagnosed with prostate cancer in his lifetime. Specific foods have been shown to exert protective effects against prostate cancer. These foods include walnuts, cruciferous vegetables, flaxseed, coffee, tomatoes, green tea, and pomegranate, supported by supplemental vitamin D and boron. Pomegranate. In a phase 2 clinical trial of men with low-risk prostate cancer, prostate tissue samples from those who took pomegranate fruit extract daily for 1 year contained significantly lower levels of biochemical markers associated with DNA damage of prostate cancer. An earlier phase 2 trial was undertaken in men who had undergone surgery or radiation for prostate cancer and who subsequently showed rising PSA levels. Patients who consumed 8 ounces of pomegranate juice daily had a delay in PSA doubling time, the time it takes for PSA levels to rise. Preclinical data show that pomegranate components protect against multiple aspects of prostate cancer, including growth, progression, and spread, by inhibiting tumor cell proliferation, cell division, invasiveness, growth of new blood vessels, and metastasis or spread. More dietary tips. The Mediterranean diet, which is rich in whole grains, legumes, vegetables, fruits, and nuts, has been associated with reduced risk of prostate cancer and prostate cancer-related death. High fiber intake is linked with reduced prostate cancer aggressiveness. Eating low glycemic foods, foods low in sugars and unhealthy carbs, as well as adequate fiber, protein, and healthy fat, may reduce prostate cancer risk. Certain foods have been associated with greater risk of prostate cancer, including eggs, milk, and processed or overcooked meat. A review found that 3 components of pomegranate exhibit these inhibitory effects on prostate cancer growth and spread: lutolin, ellagic acid, and punikic acid. Boron. A study found that men with the highest boron intake showed a 54% lower risk of prostate cancer compared to those with the lowest intake. In addition, they reported that increased dietary boron intake was associated with a decreased risk of prostate cancer in a dose-response manner. In an animal model, scientists orally administered various concentrations of a boron-containing solution. This resulted in decreases in prostate tumor size by 25% to 38%. Remarkably, PSA levels dropped by an astounding 86% to 89% in the animals that received boron. These findings suggest that supplemental boron may have both preventive and therapeutic effects, helping both to shrink prostate tumors and to decrease levels of PSA. Green tea. One clinical trial found that green tea catechins were 90% effective in preventing prostate cancer in men with pre-malignant lesions. The researchers recruited 60 men aged 45 to 75. 30 participants received 200 milligrams of green tea catechins 3 times daily, while the other 30 subjects received a placebo. Biopsies were conducted at 6 and 12 months. Remarkably, only one man in this pre-malignant green tea group was diagnosed with prostate cancer, compared to 9 men in the control group who were diagnosed with the disease. No significant side effects or adverse reactions were reported. The lead researcher concluded that 90% of chemo prevention efficacy could be obtained by green tea catechin administration in men prone to developing prostate cancer. Green tea polyphenols have also shown efficacy as an adjunctive therapy. Prostate cancer patients were given 1,300 milligrams of green tea polyphenols, mostly EGCG, prior to the time of radical prostatectomy. They showed significant reductions in PSA and other tumor promoters such as vascular endothelial growth factor. Vitamin D. Observational studies have shown cancer risk reductions of up to 50% based on higher vitamin D status. People with higher vitamin D levels have lower odds of lethal prostate cancer. It's difficult to get enough from food sources, and there are risks with sun exposure. Scientists have determined that supplemental doses ranging from 5,000 IU to 8,000 IU daily can bring blood levels of vitamin D up to optimal ranges associated with reduced risk for chronic disease. Regular blood testing is important to guide adjustments to these doses to achieve the maximum benefits. Grapeseed. Grapeseed extract induced apoptosis or programmed cell death in prostate cancer cells. Grapeseed extract inhibited prostate cancer growth and progression in mice. A study found that men who supplemented with grapeseed extract reduced their risk of prostate cancer by 41%. Moreover, high 10-year average use of grapeseed extract was associated with a 62% reduction in prostate cancer risk. Curcumin. Curcumin induces apoptosis, programmed cell death, interferes with the spread of cancer cells, and regulates inflammatory responses. In one trial, 30 patients with castration-resistant prostate cancer with rising PSA received curcumin while undergoing treatment with docetaxel and prednisone. Improved PSA responses were noted in 59% of participants. It is so much fun out here. In summary, specific foods and drinks have been shown to be associated with a favorable influence on risk factors for and mechanisms of prostate cancer. Making walnuts, cruciferous vegetables, flaxseed, and other plant foods a consistent part of a healthy diet, further supported by supplemental vitamin D, boron, and other nutrients, could potentially save lives. and spare men the side effects of conventional treatments. Consider cutting back or avoiding red meat, especially processed meat, to further reduce risk of prostate and other cancers. Thanks for watching and listening. Please subscribe and catch me in the next video. May you find lasting happiness. Bye.